Welcome back. I'm Austin Westfall. We've been following along all day today as we have been watching Trump's cabinet nominations be confirmed one after another. We saw Tulsi Gabbard, RFK Jr., was sworn in earlier today as Trump's health chief. We did see the two of them in the Oval Office earlier today. There you see Neil Gorsuch as well. Gorsuch is a Supreme Court justice who officially swore in RFK Jr. earlier today. You see Cheryl Hines there, the actress. It's RFK's wife. We were watching Capitol Hill late last night, as I mentioned, as Democrats were giving their 2 cents about why they felt that RFK should not be confirmed. We did ultimately get a vote today, and Senator Mitch McConnell was the lone Republican who did not vote for Kennedy's nomination. He voted against him. There, of course, has been a lot of discussion over RFK's positions. Some of them cause more discussion than others, and our next guest is an expert on something that RFK made one of his priorities on the campaign trail. Dr. Evan Nadler is a surgeon, professor, and author. His upcoming book is called Diet and Exercise Has Failed, the Social Imperative to Treat Obesity at Every Age. Doctor, thanks for coming on.
Thank you much, Austin, for having me. Really appreciate it.
So let's talk about, this is an interesting one. So there's, as I mentioned, there's so many directions you could take this RFK story, but some of the most recent CDC data I found was alarming to say the least. It said that 1 in 5 U.S. children and adults have obesity. We remember Michelle Obama. She made it a priority during her tenure as First Lady to focus on childhood obesity, and now it's coming back up again in the form of RFK's rhetoric. He wants to change food policy in America, Doctor. What do you think of what he's laid out?
Well, so first of all, the numbers are actually more alarming than what you've even just enumerated there. So data that I saw today actually show that 40% of adults have obesity and 20% of children and adolescents. So some of the points that RFK made during his, when he was sworn in, how the nation is in crisis, those are legitimate. We've needed to have this conversation as a country for a while. And so I'm frankly glad that he's bringing it up.
Again, those numbers are staggering. No one wants to be unhealthy. Why is this issue such a tricky one to solve?
I think the major issue at hand is that obesity looks the same to everybody on the outside. So we all think we understand the disease, but it's actually a very complex disease. And the data show over and over again that diet and exercise alone can't treat that disease.
What can? Diet and exercise alone doesn't treat it, but it certainly can if you do it correctly, can't it?
Well, so again, the clinical studies that have been performed show that, yes, a small number of people can, or you remember The Biggest Loser on TV, those people could, but you can't sort of recreate that Biggest Loser atmosphere in the real world. So the issue is that a lot of people need help, and it's super important that we change food policy in this country, and I think that is a nonpartisan issue that hopefully everybody can get behind. But that alone won't actually curtail the obesity epidemic. That's more of a long-term play.
Yeah, so you're the former co-director of the Children's Obesity Program at Children's National Hospital. I think you were at that post for over a decade. During your time, and since that time, as you've learned more and more about this topic, what have you learned about what's caused America's obesity battle? That's a big question, but what have you learned?
Again, it's a complicated scenario. It's not one thing. It's not sugar, although we definitely eat too much sugar in the American diet. It's not ultra-processed foods, although ultra-processed foods aren't good for us and we should eat less of them. It's really a combination of of those factors and the sedentary lifestyle that we lead. And, there's no one magic bullet. And that's why it's going to take more than sort of one fix to curtail the direction we've been going in.
Yeah, your book's title says it's a social imperative to treat obesity at every age. Why do you feel the need to say every age? Do you feel obesity within some age groups aren't being given enough attention?
Well, for sure, I'm biased because I'm a pediatric surgeon by training and have been doing weight loss surgery or metabolic and bariatric surgery on children for over 20 years. And yes, I think they deserve a little bit more attention. And again, RFK is bringing it to the people. So I think hopefully now the childhood obesity epidemic will get sort of the same attention that the adult obesity epidemic has been getting over the years.
All right, Dr. Evan Nadler, we appreciate you coming on tonight.
My pleasure, Austin, anytime. Thanks for having me.